I address this in the book, in my book, and it's about the healthcare issue. We're talking about it, and all I will say, and that's to folks in Alberta, and really in the states and state by state, is there's enough money to have absolutely phenomenal health care, the health care that we all dream of, and the health care that I and my family have received in our lifetime in 3 states in the United States. You can have absolutely fabulous healthcare. It must be market driven. It must be on a really clear model, which is established. I'd say this again. I'll pivot here. I didn't think I was going to talk about it, but it's important. You can have incredible coverage like I experienced in Washington State was with Kaiser Permanente. And they were a large HMO. They're affiliated. It was like many of the hospital networks do, where they're it's a conglomerate and stuff. But they were so beautifully managed. They had it was literally appointment for everything, no problem. Short notice, no problem. Pharmacy in the facility, X-rays in the facility. They had it set up as a beautiful pod. It felt like an airport where you'd walk in and be greeted, and literally virtually everything was within pods within this facility. But most importantly, they brought a personal touch. Not only was it just you present your Kaiser card and that you pay $10 or $15 copay, maybe sometimes zero, and you go down to your doctor. You got a personal doctor, relationship doctor. And I told this story. I told this a long time ago on the air. I believe it might. I don't know if it was with you, Val, or was it with whether it was with Mike Phillip and up in Edmonton. But I'd said I got a call one evening. I think I put this in. Yeah, I put this in the book, my healthcare section. Got a call one evening when I was living up in the Seattle area from my doctor. And he said, Mr. Meakin, during your visit earlier today, it looks like you had a little weight loss, a little concern, 8 pounds, 10 pounds, whatever. We had a whole phone conversation in the evening with him because he was worried about it. And I was like, wow, this is great care. This is great care. So you can have great care. I've heard even, we've got there were nightmare stories about the VA, but there are also good stories down here about the VA. And all I'm saying is there's plenty of money in Alberta. There's plenty of money in the United States. There's working business models right now that are beautiful healthcare. And I mean, Val, cradle to the grave. And the model that I set up in my book, I think it was, I'm going off of memory, it was a checklist about 6 or 8 things that need to be done in order to improve healthcare. But we have the money to do it. We have the great people to do it. There are folks out there. So much is based on staffing, so much. You've got honestly some terrible employees out there in the world in general. And then you have some angels and Sally's, as I've written about, totally efficient, great, personable people. So I'm actually, I'll just wrap it up here on you can have great healthcare.